All right, for chapter 11, we're going to look at the muscular system, and this is going to be more of an introduction, and then in part 2, we're going to go into a little more detail. Now, you guys are going to learn the location of approximately 50 superficial muscles of the nearly 700 muscles that are in your body. Okay, so you're not going to have to learn all the muscles in the body like what your labs show, but you are going to have to learn a good portion of them. Now, when we look at these muscles, not only do you need to learn their name, their location, but you're also going to need to know their action of what they caused to happen, and also their what we call orientations and insertions, or what we would say origins and insertions. So we're going to talk a little bit about those mostly in part 2. So the general function of the muscular system is to produce movement, to stabilize your body positions, and to generate heat, thermogenesis. Now guys, we're focusing here on the skeletal muscles when we're looking at the muscular system. Now, the muscular system directly contributes to the homeostasis of all other body systems. So when we look at your skin, skeletal muscles are going to pull your skin to produce facial expressions. They're also going to increase blood flow to your skin. We see that the skeletal system is going to work with the muscular system to produce movements. The skeletal muscles also help to stabilize your joints. Your nervous system is going to have all 3 types of muscle tissue responding to nerve impulses. This is going to help with involuntary nerve impulses causing shivering to increase your body temperature. And even your endocrine system, the hormones. Exercise improves certain hormone actions like insulin, and muscles help to protect some of your endocrine glands. So we do see that they're going to help with lots of different types of homeostasis. When we look at the cardiovascular system, we see that your heart is made out of muscle. This is cardiac muscle, but that pumping, smooth muscle is going to help regulate blood flow. Your skeletal muscle is going to help return the blood flow back to the heart with venous return, and exercise also improves the efficiency of your heart. With the lymphatic system, we see the skeletal muscles protect some of the lymph nodes and the vessels, and skeletal muscles promote lymphatic flow just like they do with the venous return with the blood. When we look at the respiratory system, guys, skeletal muscles are involved in your breathing. Okay, those have to contract in order for you to breathe in. Smooth muscle is going to adjust the bronchial diameters in your lungs. Skeletal muscles are going to vibrate on your vocal cords so that you can create sound. Skeletal muscles are also involved in coughing and sneezing, which is a protective mechanism for your respiratory system. And exercise also improves the efficiency of your respiratory system. So when we look at exercise and we talk about somebody getting in shape, we're not actually talking about this kind of shape. We're talking about their cardiovascular system and their respiratory system getting in shape. Those muscles being more efficient in supplying oxygen and nutrients to your body. With your digestive system, we see that skeletal muscles protect and support your abdominal organs. The skeletal muscles are also involved in chewing and swallowing, and smooth muscles are going to cause the movement of food through your GI tract. For urinary system, skeletal and smooth muscles are going to control the action of urination. And then in the reproductive system, skeletal and smooth muscles will cause ejaculation. Smooth muscles will move the egg through the fallopian tube. And then also smooth muscles will regulate uterine contractions during menstruation and childbirth. So if we notice here, these muscles are present in pretty much every other system, and they're going to help keep those systems active and functioning properly. So let's look at the skeletal muscles and how they produce movement. So guys, tendons are going to attach the muscles to bone, and this helps produce the movement by pulling on a bone. When muscles contract, it draws one bone towards another bone. Most muscles cross at least one joint and are attached to the articulating bone that forms the joint. Now, there is an exception because when we talk about your facial muscles, they're actually just attached to your skin, not to other bones. Okay, and they are going to allow for expressions to take place. But most muscles, besides the facial muscles, are going to cross a joint. We see that there is an origin when we talk about the muscle. This is where the tendon is attached to the stationary bone, the bone that is actually not doing the movement at that time. We then have the insertion where the tendon's attached to the movable bone. So in this case, guys, it's showing you the bicep. Okay, so the bicep is on the front of your arm here. The origin is in your shoulder because when you actually are going to be doing flexion of the elbow, the shoulder does not move. So that's where the origin is located. The insertion is down here on the radius. okay, on that radial tuberosity, that rough spot on the radius that we talked about, that is where the bicep is going to attach. So when it contracts, it's pulling that bone up towards the stationary bone, which is the shoulder. Okay, so the origin is going to typically be more proximal, and the insertion is going to be typically distal. Now, the insertion is going to normally pull towards the origin in its movement. So this example is the biceps brachii, the biceps muscle. The origin is on the scapula. Okay, so it's up here in the shoulder region. The insertion is on the radius, specifically on the radial tuberosity. The belly of the muscle is the fleshy part in between, which we call the bicep itself. So some important concepts here, guys, is that muscles typically do not cover the bone they actually move. See how the bicep is covering the humerus, but the humerus is not the bone that it's actually moving. So muscles in the arm are going to move the forearm. The bicep is going to run adjacent to the humerus, but it moves the forearm. Muscles in the forearm are going to move the wrist and the hand as well as the fingers. Muscles in the thigh are going to move your leg, and then muscles of your leg are going to move your ankle, foot, and toes. All right, so they normally are going to be above what they're actually going to allow for movement. Now, bones do act as levers. There are 3 different classes of levers, but guys, when we look at a lever, they're going to have a fulcrum area. This is going to be the joint. They're going to have a load, which is the resistant. In this case, it's the bones. And then we have the effort, which is the muscle. The muscle has to put forth effort in order to move the load. And it can only move the load due to the fulcrum that's there, the joint that's created. So guys, this coordination among muscles, most muscles do act in groups. Most muscles are arranged in opposing or what we call antagonistic pairs in order to generate movements. So the prime mover is the muscle that causes the desired action. So it's known as the agonist. However, the antagonist is going to yield the effect of the opposite of the prime mover. All right, so when we look here with flexion of the forearm, okay, when we're going to flex the forearm like we do here, this primer muscle is the biceps brachii, and it contracts. But in order for the bicep to contract and pull the forearm up, the antagonist muscle, the tricep, must be relaxed. But if we want to do the opposite movement with extension of the forearm, the primary muscle is going to be the triceps because it contracts, and the biceps, the antagonist, because it has to relax. Now, there are some synergist-muscles. These are muscles which are going to help stabilize the prime mover. Some examples here is we have the temporalis and the masseter. Both of them are going to help you elevate your mandible, pulling your jaw closed. Okay, so they're going to help each other in that movement. Another are hamstrings. Your hamstrings are collectively 3 muscles on the back of your thigh. All 3 muscles are going to help you flex your knee. Okay, flex your leg at your knee. The quadriceps is the opposite of the hamstrings, and it's 4 muscles collectively working together to allow you to extend your leg at the knee. All right, so these are going to be where multiple muscles are working together for a common task. Now, characteristics that are used to name muscles. This is going to help you hopefully remember the different names of some of these muscles. Sometimes muscles are named based on the direction of their muscle fibers, how their muscle fibers are running, the direction-wise. There's what we call the rectus. These are fibers that run parallel to the midline. Okay, so rectus abdominis are going to run parallel to your midline, and they are going to be in your abdominal area. We also have transverse. Transverse means they're going to run from side to side like a transverse plane. These fibers are going to run perpendicular to the midline. So examples here are the transverse abdominis. They're your abdominal muscles that are running this direction. Oblique is going to be at an angle. So these fibers are running diagonal to the midline, and these can be what we call your internal and external oblique muscles, which again are part of your abdominal muscles. We also see muscles could be named based on the size of the muscle. If the muscle is very large, it may have the name maximus with it. So we talk about the gluteus maximus being the largest muscle in your behind, in your buttocks. And so we see that that's going to be the largest. But we can also see the smallest. The gluteus minimus is the small muscle. Okay, so maximus is large, minimus is small. Another way we can look at the size of the muscle is if it's really long or if it's short. We have the peroneus longus. This is a long muscle versus the one that's shorter, which is called the peroneus brevis. It's a shorter muscle. Muscles could also be characterized by their shape. So the deltoid has a triangle shape to it. Okay, so you can see here the deltoid. A trapezius has a trapezoid shape. Okay, so it has a trapezoid shape, thus giving it its name. Serratus looks like a sawtooth, so it looks like one of those serrated knives, okay, like a saw that's present. And then we have platus. Platus means flat. Okay, so this is a flat muscle that runs in your neck. We also see muscles could be named based on the action that they produce. We have some muscles that are known as flexors. Okay, so those are going to cause a type of flexion. We have other muscles that are extensors. They're going to extend a body part. We also have abductors and adductors. We have supinators and pronators. And so what we're showing here is, especially in the arm and leg, you're going to find lots of muscles that are going to be named like that. But guys, if you'll notice, some of them also have a length to them. Like if you look here, you have the extensor carpi radialis longus. This tells you that it's a long muscle, but it's going to do extension. All right, so it's giving you a little bit more information about it based on even giving you the length of the muscle. All right, so this is action of muscles. We also see that a muscle could be named based on the number of origins. This, remember, is the stationary attachment. So when we look at the biceps muscle, there's going to be 2 origins. Okay, so it has 2 places where it attaches. A tricep has 3, quadricep has 4. So the name kind of gives you an idea of how many origins are present. Sometimes they're named based on their location. Like here we have the temporalis. The temporalis muscle is on the temporal bone. We also have the tibialis anterior, which is going to run along the tibia on the anterior or front surface. So the tibialis anterior runs on the front side of the tibia. So again, giving you a location and the bone that it parallels or runs with. We can also see that they may be named based on their origin and insertion. Okay, the 2 bones that they connect to. So we have here the sternocleidomastoid. This is going to connect down at the sternum clavicle area, and it's also going to connect in the mastoid process back here on the temporal bone. So it's the muscle that runs this way between those 2 bones. Now guys, muscles are divided into groups that move specific areas of the body, and this is also how you are going to end up modeling the muscles when you work in lab. Okay, so you're going to take your clay or your Play-Doh and you're going to model these different muscles on your little skeleton. So there's going to be muscles that we're going to look at for facial expression. There's going to be muscles that move the mandible. This is for masticators, which help you chew or move your mandible. We are going to look at muscles that help you move your head. Muscles that act of the abdomen and the vertebral column. We also see muscles used in breathing. Muscles that move the pectoral girdle or your shoulder. Muscles that move your arm. Muscles that move your forearm. Okay, so we're going down. Muscles that move your wrist and your hand. We're also going to do the same thing for your lower extremity, where we're going to look at muscles that move your thigh, your leg, and your foot and toes. All right, so this is what we're going to focus in mostly on part 2 of this lecture. So some concepts before we move into looking at those directly. Typically, muscles are attached by an origin or an insertion. This is going to be into a bone via a tendon or through what we call an amphiarthrosis. So guys, if you'll notice here, there's a tendon. That's the Achilles tendon. An aponeurosis is what we would see here, where it's a flattened sheet of tendons, and it's going to cover like the abdominal organs. Okay, so it's a flattened sheet. We also see typically facial muscles originate on bones or a fascia, and then they insert into the soft skin tissue. This is what allows you to be able to move that skin to create facial expressions.